Earlier this month, TogetHER's team sat down with Dr. Catharine Young, Senior Fellow at the Harvard T.H. Chan School of Public Health, who also leads the newly announced Global Cancer Financing Platform. We had loads of questions for her, ranging from her background as a biomedical scientist to her work with the Biden Cancer Moonshot initiative, and why Dr. Young feels that now is an opportune time to launch the Global Cancer Financing Platform.
Okay, so I'm a scientist by training and spent about 8 years in academic training between my PhD and postdoctorate work in biomedical sciences, and realized that for me personally, it was really important to be able to effect change in the world that was a little bit more quicker than toiling away in a lab in an academic institution. Not to say that those are not incredibly important people, but that was just not for me. When President Biden entered back into the White House, was brought into the White House to continue the threat of the cancer moonshot, which had been ongoing for many years, but now under his leadership at the White House. And there I was an assistant director that really worked on the global portfolio of the Cancer Moonshot. So the idea of how do we take the mission of the Cancer Moonshot but make it global. And in October of last year, so in 2024, we convened a number of experts and organizations together to kind of ask them, what would we do? What would that blueprint look like if we were to kind of launch something like a global cancer fund? Obviously, the reason why it hasn't been done yet is because it is difficult and cancer is complex. As all of us know, cancer is not one disease. And we know that a very dedicated financing mechanism like the Global Fund, which now has a lot of data coming out to show just how effective it is, saving almost 70 million lives since its inception back in 2002. We know those kind of efforts really make a profound impact. And so we are now at the point where we're like, there's no excuse. This has to be done. We have a moral obligation. Everybody knows it's the right thing to do. The overarching goal, as I mentioned before, is to mobilize at least $1 billion a year by 2030. And the focus would be around stage shifting, so catching cancer earlier, starting with breast and cervical cancer, with the idea to scale to other high burden cancers beyond that. People have looked at us and said, this is the most difficult kind of funding environment you could possibly enter into, given all the changes we've seen over the last 8 months, particularly targeted towards global health and global health funding. And people are like, well, yes, it was really important before, but how are you going to execute something like this given the incredibly difficult environment that you're operating in? And my response has always been, well, this makes it even that much more urgent for us to be able to execute on this because of the current environment, combined with the fact that cancer will literally become one of the biggest health threats in the 21st century if we don't do anything about it. Yeah, so we have what we call kind of our founding partners, which are partners who committed at the end of the administration to really see this work going forward. These are partners who have also committed in some way, either financially or in kind, to help kind of operationalize this as well. And so some of the bigger US organizations like AACR, ASCO, ACS, Stand Up to Cancer, these are all organizations that are behind and supporting this initiative going forward. We do want to kind of open this up to other organizations. So But what we're trying to really accomplish here is to understand where those pockets of money exist around the world that we could tap into that could be catalytic for cancer. So the diaspora here in the United States, so people who were born, say, in Africa, who move over to the United States and become part of the diaspora community, they send over $100 billion to Africa every year. That is an enormous funding stream that is consistent every year being sent back to Africa. What we're trying to accomplish with just this one example of an innovative financing mechanism is how do we capture just 1% of that funding and divert it to something like a global cancer fund. And there are many challenges towards that. I'll just kind of caveat that. But what is so exciting is that at the event that we hosted last week on the margins of UNGA, is that Uganda has come forward as a government to say they want to be able to figure out, working with the health minister, the minister of finance, and their Ugandan bank, to figure out how that mechanism may become viable in their own country. So I was actually really surprised at the number of people we got to attend in the first place. We actually started the planning of this event like 2 months ago, probably in earnest. And for anyone who has ever hosted an event on the sides of UNGA, know that like it is the craziest time of year in New York City, and there are hundreds of competing events happening on the margins. And so when I walked into that room last week and saw how many people had dedicated their own time to being there, I immediately was like, okay, we're not alone in this anymore. Like there are a lot of people excited and interested in this idea. And then as the event went on, you could just kind of feel that excitement building in terms of we are tapping into something new and different. It's not the same old model, because we know that will not be successful. In this day and age, we have to create something that is for the 21st century.
At Together for Health, we're thrilled at the announcement of the Global Cancer Financing Platform, and we will do our part to support the initiative going forward. We hope you will too. For more information about the initiative, go to gcf.finance. For more information about Together for Health, visit our website at togetherforhealth.org.